I'm Chris Kirshner, and I'm the Director of Corporate Communications for Community Health Network. Excited to be here for this conversation because this is going to be a fun one. This is a fun group, let me tell you, and a very informative one. So thank you for taking the time to be here on this beautiful Saturday afternoon and for taking the time to think through your care, right, and your care plan. I think that's so very important. So I hope that you get a lot out of this. Before we get started, I want to make sure that, did you all get registered out at the front table? And do you all, more importantly, do you all have a raffle ticket? Okay, because you're going to want that for later. Okay, so I just want to make sure everybody got registered. So I think the best thing to do probably is to start with introductions. What do you think, ladies?
That's good.
You guys ready to meet the midwives? And it goes in this order: Meg, Jill, and Megan. Okay, but I'm going to let them do a little bit better job of introducing themselves. Meg,
I'm Meg Malone, and I have been with Community Health Network on and off over the last decade. I've been a nurse at the labor and delivery unit at Community North, and so I've been there, and I know the ins and outs of every part of that unit for the last decade, and then became a midwife last year, and now got to return to my home unit as a provider. So I'm the newest, right now the newest midwife at Community, and passionate about making that place even better. But I really believe it's the best place to give birth in the city. And so we're here just to make sure that you guys even know that there's midwives as an option.
So yeah, I'm Jill Coker, and so I've been at Community almost the last 4 years. So we started the program right before the pandemic, November of 2019. And then before that, I was at Methodist Hospital for 13 years. And so Megan and I worked together there. And so, yeah, we've just really enjoyed creating a space for women to feel comfortable birthing and partnering with them in care.
Yeah, I'm Megan McDonald. Not to confuse you with all the Megan options. But, so I've been a midwife for about 11 years. I was at Methodist for a little over 5, and then the birth center for 3. And then I've been with Community for about 1.5 years.
Awesome. We first want to start off, and before I get started, I'm gonna kind of lead this discussion. God bless you. I'm going to lead this discussion and ask a few questions, but really the important thing is that you get your questions answered. And so we are going to have an opportunity for you to ask your questions. So as we're going through the conversation, if you think of some, let us know, and we'll get you a microphone. Don't be shy. We're all friends here. And I'm sure whatever question you have, somebody else probably has that same question and will need it answered. So we'll have plenty of time for that. So I think it makes the most sense to talk about midwifery as it means, what it means to at Community Health Network. How's Community different with its midwife program and our approach to care? And so I'm going to let you guys kind of start us off with that. And what does that model of care look like from Community Health Network standpoint?
Yeah, so midwifery looks different than GYN care, just a little bit, mostly culturally, I think. But we at Community are an independent practice where you may never meet an OB/GYN unless you need one. So that's kind of what's different about our midwifery group than other midwifery groups in the city. Not everyone does it that way. So I think that's really neat. You know that you might never need an OB/GYN, but if we have one, if we need one, we have one right there. So they're alongside us in the hospital. If we need them, they're right there. But throughout your pregnancy and things like that, or if you need things for GYN care, if we come across something that is a little bit more invasive or you need surgical intervention, then we would help you find the doctor that we trust or send you to our collaborating physician that works with us. So midwifery, it looks different based on how we view the birthing process and the general women changing through life process as a normal process. So that's our biggest thing. My biggest push that I think midwifery is different and why I'm more passionate about it is our approach to making decisions is we practice something called shared decision making, not just informed consent. So that's what I explained. It's just a subtle difference, but we are partnering with you in your care and what do you want? This is your body, your pregnancy, your baby. You make the ultimate decisions. Our job is to just give you the best information and help you feel like you have someone to ask those questions to and have the doors open.
Jill,
Yeah, sounds good. I'll let Megan talk about the second talking point, and then I'll go to the third.
Yeah, is it the team-based? Yeah. Sometimes I wear glasses, and today I did not, so I can't. So yeah, kind of like Meg talked about team-based care. So in our practice, we have 7 midwives. At least that's our goal. Yeah. We're getting there. We have 5 practicing right now. We've hired 2 more. But we work as a team. And so, in some places you might come and you mainly see like one person. That's your midwife. That's, we share. So, you might see lots of us. You might see just a few of us. But we work as a team. And then beyond that, we do have the collaborating physician that, if we have a question, if we have somebody who needs to risk out, we work very closely with her. And then in the hospital, we also team with the nurses and the OBGYNs there in case something comes up. So it's kind of a good setup. Like I said, I came from the birth center, and so obviously different than that kind of model. But yeah, it works well, very seamlessly. If you do need a different level of care, if your baby needs a different level of care, it's a really great environment.
Yeah, I'm going to tack onto that a little bit. So with community, like one of the reasons that I like it is like if our patients needed like an abdominal birth, cesarean birth, then we go back there with them and support them during that process. So we're like at other places, it's like, oh, they get passed off to the physician and they just take on their care. We continue to round on those patients. They come back to see us afterwards. We have a lot of patients that come see us for VBAC in the hospital. And so and our rates are really good as far as that goes, so that a lot of times they'll return to us with care. But like, I think that we want to be a part of that process too. Like we want to follow that because not just of healthy mom and healthy baby, but like the full process and what that looks like is important to us as well. And so we're happy to be a part of that community the way that is set up. And then like the last point, so optimal versus normal. So in pregnancy, like always thinking about like what things that we do, what we put in our bodies, chiropractic care, physical therapy, like what can we do to like optimize like the process? So we're always thinking like what would be beneficial to the body and make it easier for moms and families and just to, their health in the pregnancy. So we're always trying to connect people, with that and not just looking at like, coming in, oh, your blood pressure looks good, or your baby sounds good, out the door. We get more time with our visits. And so we're able to talk about, what does your plan look like? What is your family? Do you have other kids? What does that look like? So it's more, I don't know, we just get to know you at a different level than the other offices probably do. And we enjoy that. Like that's part of what makes our job enjoyable too. So
as involved as you want your family to be. If you want your mom, like we encourage you to bring your moms and your grandmas because they didn't have options like this when they were birthing, or they, have a lot of fears or things that they've never talked through. And so like we want you to bring your family and ask questions because what is a midwife? Why are you doing this? Okay, bring your dad. Like, why is he anxious? Let's, that kind of stuff. So I think that's also a different like model of like, it's not just get in, get out about your body. It's about the whole family. And we do a lot of not necessarily mental health care, but like we'll get you started in that system and make sure you find somebody you trust. Or like if you really don't like your therapist and you just haven't solid, you have somebody to give you some options, or like, you feel like you need some meds, we can do that. Or we can talk about how we can try to do stuff without jumping to medicine first. But we want the whole health, not just to survive the birth,
Yeah. I love that team-based approach. Of course, that's something that is across community, across the board when it comes to our care, and that whole patients first approach. Yeah. And I love that whole notion of, right, everybody come in and be a part of this process.
And we do have an awesome NICU, a level 3 NICU, and 4 ORs if we need them. And we have everything we need if we need them.
Yeah.
And our patients, we have some people that end up needing those things or have a planned C-section for any reason, or need to have NICU there. We know it because of something, and they're still our patients,
So that's what sets kind of community apart. Those are some special things about community, but there are hallmarks about midwifery across the board. And you even said, gosh, what is the midwife? What are you doing? So let's talk a little bit about what are those hallmarks of midwifery. Just give us a broader idea of what does it mean. And
So I just picked a few of the hallmarks of midwifery. Nurse midwives we have this whole list of things that we're supposed to like abide by and help us guide like why we do what we do and philosophies of care. So I just picked some that are really special to us. I kind of just picked 2 for each of us that I feel like we're passionate about. But we're not gonna like read through them, but we've kind of talked about them. Like this one's really about health promotion and like recognizing this as a normal process, like Jill spoke to.
Yeah. I see a lot of patients for like preconception visits. So like we kind of go through their health and is there anything we can optimize before they get pregnant? Because we know that impacts the pregnancy and forward. So like before, during, and after. So even postpartum, a lot of women, as we're growing a baby and then we're feeding a baby. So depletion and things like that can happen, during postpartum. So just trying to figure out what does the body actually need? How do we need to support it? Like that's a lot of fun to me. So We do that a lot with our patients. And so, and honestly, after the birth, it's not like, bye, we'll see you later. It's like, anytime in that first year, if you're just saying, like, you don't even have to label it like anxiety or depression. If you're just not feeling good, or you're like, I feel like I could feel better than what I feel like right now. Sometimes it's hard to tell. Is it like just because I'm exhausted and I've had kids, but there's always ways to optimize, and we always want to see patients back if there's something we can do to help make that better.
Yeah, and I definitely tell people, we definitely at your postpartum visits, people are like, I'm done with you. And I'm like, no, you can still come to us for all your GYN stuff. If you think you have a UTI, if you have anything about your womanly body or birthing body that like you have questions about, or like, you have a teenager that you want help on birth control, but that you don't want to take them to somebody that might ask them to take their pants off the first time they meet them. Like, that's just not our style. And so it's just for like one-on-one, like partnering in your care kind of thing. But I think it's important to think about midwives more in the broad scope too, not just births, because I feel like I have a lot of friends that come to midwives for just you have more time and more attentive care for your GYN stuff. And if it's something that we can't do, then we will get you to who you need to go to.
Megan, do you want to talk around like health education, disease prevention, that kind of thing?
Yeah. Like they were saying, we care for women through the lifespan. So, whether it's in pregnancy or outside of pregnancy, we want to give you lots of resources. So a lot of times educating people on, what's available to you, what could you do to, like Jill said, optimize things. So a lot of times, we are talking about it in the visits, but we're also arming you with all kinds of education resources. In your after visit summary, you might get links to all kinds of different articles. And so a lot of what midwifery is education and giving you the information you need to make a decision for you. So that's that shared decision making Meg was talking about too.
We talked about it being family centered, obviously, getting everybody involved. But when you do say shared decision making, what does that look like? Is it just here's the information, let us know what you want to do, or talk a little bit more about how that works?
I even had a patient one time who said, "Stop giving me options, just tell me what to do." So, maybe it gets to the extreme point of that, but no. But, again, it's maybe during this visit, I'm going to bring something up that I say, next time we're going to be talking about this lab or this vaccine or this thing that we're going to offer you. Here's some information about that so that next time you come in, we can have a conversation about if that's the right thing for you. Or in that conversation, they might say like, hey, I heard this. Tell me why I would do this. Or we're going over a birth plan. And it's like, well, tell me why you put this on your birth plan, So finding out like what's important to you. Why is that important to you? Where did you even get this?
Yeah.
Where did you TikTok, or was this like, So, just finding out like where people are getting information, making sure they have the best information to make a good decision so that at the end of the day, you walk away thinking, I feel confident that that decision was my decision. And I knew that this was a risk. And, and just feeling like people aren't doing things to you.
Yeah, it's empowerment, right?
Giving the control back to the person that is doing all sorts of things. Like, we're just here to support you. Like, people are like, thank you so much for doing that. I'm like, I didn't do anything. I just protected your space and like made sure you were safe and was here if you needed me. Like, that's kind of our goal. Does that make sense?
I would just love to know what drew you to this profession. Tell me a little bit about your journey.
We're people that have been patients, and I know women that have been in stirrups and have quite a few things that have been offered to us or told to do. I think that is really the base of where this comes from, is making sure that like we've seen things that are like, ooh, we want to make that better. Or we were all labor and delivery nurses first and like want to make that better. But
I had an alternative route to midwifery.
Like we've been a part of births even before midwifery, or like watched how the system works and want to make a change from the inside and make it better.
Yeah. A couple things. So when I was working as labor and delivery nurse, there were definitely things that I was a part of that I didn't like, that the patient wasn't given options. And then like, I'm the nurse that's only met this patient for like, 2 hours. And so like, I just didn't have any weight in that conversation, and the patient didn't know that they had more options. And I just felt like I was a part of that. And sometimes trauma, like I felt like I was a part of it and I didn't like it. And I wanted to be able to give women options so that they can make the best choice for their body. I just I literally couldn't do it anymore. Like, it was just, I don't know, there's just a better way for it to be done. And then the other part, when I was in my undergrad as a nurse, we had the chance to do like a cultural experience of sorts. And so I went with an Amish midwife and like traveled around to families' houses, and like she would listen, like check their blood pressure in their home and like listen to the baby, and the whole family was around. And I just thought, like, this is like a family experience. It's not like this cold, like, I don't know, medical, whatever. It's like these experiences that we go through at birth are like, generational, and it just really impacts so many things. And it was just really important to me that those spaces, like she said, are just created like delicately and with support, and women doing what they need to do to birth their babies, like, we're just there to catch baby. We're not delivering the baby. Like, we're just there to support it. They're doing the hard work, and we just want to make it easier for them. Yeah.
I was always kind of obsessed with like pregnant people and babies. And I just figured all little girls were like that. And then I went through school, and I kept telling my mom, well, I don't want to be a nurse. Like, I was doing nursing school, but I don't want to be a nurse. I want to like work with pregnant women and deliver babies. And she's like, and then someone said the word midwife, and I was like, sorry, like, we're in the 1900s. I'm like, no, we're like not doing midwifery, right? And she's like, no, that's a thing. And so I looked into that. I'm like, yes, that's what I'm like in school for now. So I just figured that's what everyone who wanted to be a nurse wanted to do, and it was not true. So that's how you know it's your calling. That's my calling. But yeah, it was really about just listening to that, and then getting really interested in the advocacy and in those other parts of it as I went through just that haphazard way of becoming a nurse, I guess.
Yeah, you do mention some, even in your own journey, about what are people's notions of a midwife, right? Does it seem like an antiquated notion, or, and so can you kind of talk about that? Are we getting more information out there? People aren't understanding it, or what would you tell people when they say?
I'm super passionate about that because I come from a family of all software engineers. All four of my grandparents are software engineers, but my parents are software engineers. I just wanted to do anything besides sit in a cubicle. It just sounded horrible. And so I had no idea what even a nurse really did. So I'm really passionate about, like, why would you know what a midwife was if I didn't even know what that was? Like, I didn't even know that we don't leave a needle in your arm when I give you an IV. Like, and I'm a smart person. So, like, how can anybody know what a midwife can do? And so I think that's another reason I'm like, I want to do this. And we want people to go home and, like, tell your friends that there's options. And, like, we don't care if you come to us. We want you to find the place that you feel like you're the most supported, whatever that looks like, whether you're pregnant or not, whether you're looking to not be pregnant, right? But the big thing about midwifery that makes me so on fire is like watching people learn, especially women, that like they're capable of something really hard, because our whole lives have that doubt in our heads. And so like, it's really empowering to help someone walk through something really hard and be like, I can do anything now, including raise these children and like be the head of this household and make decisions. Like we should go to the doctor. So yeah, midwifery is such a moving thing and growing thing. And I was explaining to this midwife student, like it's a big growing beast, especially in the Midwest. It is different than even just 5 years ago. Like I said, this program's new with community, and we expect it just to continue to grow and change. And we have seen a lot of awesome change in the hospitals from it. But yeah, not bad.
Yeah, and there's a lot of different paths to midwifery and a lot of different types of midwives. And so even within midwifery, there's differences, there's nuance, and so we are all three a specific type of midwife. We're certified nurse midwives. We went through that nursing training. We went on to get our master's in the way that a nurse practitioner would do. And then, we have this specialization in midwifery. Other midwives, there's direct entry programs, there are kind of apprenticeships, there's different ways of becoming a midwife. Those types of midwives don't work in the hospital, and part of that is philosophy and culture, and and so I think there's probably reasons why people choose different paths in the same way that there's reasons that patients choose different paths, right? They're looking for something specific. And so, sometimes we can help guide you in that too. I think there's people...
there are sisters out there delivering babies at homes. There, even if we're trained differently, like we want to network with them, and we want birthing in Indiana to be safer overall, whatever that looks like. looking for, it depends on what you need in the midwives. And I think a lot of people are seeking out midwifery care because they've had bad experiences in OB care or in GYN care or in personal sexual care or in traumatic home stuff. And they feel like they just need to feel safe. And so we really just want to make it so that you feel safe to figure out what do you need. And you might not know. You're just like, I just know that it didn't feel right when I had a pap smear 10 years ago. And I know that I was supposed to go back, but I can't. And it just feels wrong. And I'm like, okay, let's talk about that and how we don't have to do that today. But why do we do that? So I don't know. It depends on what you need in a midwife, I suppose. But it's a lot of relationship building, I suppose, more than just clinical decision making.
Yeah. Jen?
Oh, me. Yeah, I can. I know. I know. I know. What was your question? I know.
What would you recommend if they're starting that journey to look for someone? What should they look for?
Yeah.
Maybe what questions to ask.
I know.
Yeah.
Yeah. So we do, like meet and greets in the office too, like one-on-one with families and stuff like that. And so we kind of talk through like just what Meg said. Yeah. Talk through what does that look like? I would say we do care for a lot of patients that like maybe had traditional OB care and just felt like something was missing. They didn't like it. They didn't feel in charge. They felt like things were done to them that they didn't need or didn't want. And so like, we're like basically the opposite of a lot of things. It's their body, it's their baby. I'm asking for permission. So should everybody else? Like, it's just that, like, nothing's being done to them. It's, having that conversation and giving us the okay